In today's lead, how quickly they fold. Republican Senator Scott Brown of Massachusetts, the guy who got elected on his pledge to beat pork barrel spending in Washington, well, he's now rooting for pork barrel spending, specifically for General Electric's bid to build a backup engine for the F-35 Joint Strike Fighter, something the Pentagon itself actually says it doesn't need. Scott Brown says it's all good, it's important for his state, the backup engine is necessary for national security. Quote, this project, he says, benefits both our military and our state. Pork for home state Boeing's fine for Brown. Pity he doesn't feel the same way about health care. On that topic, there are thousands of nurses out striking in Philadelphia, where there's a fight at Temple University Hospital. We'll hear all about it. Here's some footage from the field. Take a look.
I've been a nurse at Temple Hospital for 29 years, and 29 years ago I made a commitment to this community, and I stand here now just as committed to my patients and to my fellow workers as I did all those years ago.
Our picket line is starting now, and it's going to be here until we have a contract.
Here's the bottom line is they want to say it's about wages and benefits and that's all it's about. You know what, if it was about money, they wouldn't be spending $10,000 a week for these nurse replacements to come in. That's a lot of money.
With me, joining me from Boston, a woman who was just on the front lines there on the picket lines in Philadelphia with the nurses at Temple is Karen Higgins. She's co-president of National Nurses United. Karen, welcome to GRITtv. Who's there on the picket line in Philly?
I'll tell you, it's a very strong group of nurses and healthcare professionals that are there, and they're fighting a good battle to do what all of us need to do, is protect our patients.
Do you think we're ever going to see a day where General Electric has to walk a picket line?
You know what, at this point, and with healthcare and everything going on, you never know, but it's very sad that we have to see nurses out there on a picket line in an attempt to protect patients on a daily basis.
Talk about a little bit what's at stake there, and the gag rule that I understand has been applied. What's at issue?
Well, it's an issue that honestly affects all of us, and I think that this is a prime example of why we're all going down there to help out, because as a staff nurse that works with patients every day, two things, gag rule is to prevent us from actually speaking publicly about when hospitals are doing bad things that are affecting our patients, and to stop us from being able to publicly say that. And we're there, we may work for you, but we're there basically to take care of those patients and protect them. And that is unacceptable to have that kind of a rule to try to stop us from talking on behalf of patients.
Now, one of the things I hear nurses talk about all the time is staff-patient ratios. That sounds like that's of issue also at Temple.
Oh, it's huge. I mean, it's huge. As you know, California has ratios that limit how many patients a nurse cares for. We've been fighting for 12 years to also get legislation to limit how many patients we care for. And I think across this country, you ask any nurse that works on a day, in a hospital especially, and they will tell you the practice is that there is no limitation, and we always say, especially in Massachusetts, we limit how many children are in daycare, but if your child is sick and in a hospital, we don't really care if that nurse has 6, 7, 8 patients. It's unacceptable. It's not safe, and our bottom line is making sure our patients stay safe.
Do you think the patients are safe who are in the charge of those replacement nurses that were mentioned on the picket line there?
No, I don't. We've in Massachusetts had strikes as well, and I'm sure other places will tell you the same thing. We call these nurses scabs. They come from other parts of the country. They're there basically to make money. They do not have the commitment that we in the community, and I know Temple's the same way, do not have the commitment to those patients. They're just there to make some money, and they'll move on to where the next fight is. So no, they're not safe in there, and they're not being well cared for by those nurses.
Now, you talk about talking to nurses all across the country, which is what Nurses United is really all about. You're with the Massachusetts Nurses Association, but in the last few months, nurses have come together from all across the states to form a new massive union. Tell me why and what you hope to accomplish with this new national body.
Well, it's been a long time coming. For those of us that have been nurses on the front line for a long time, we kept saying, when is this going to happen? And it finally did in Arizona. And what it is actually a union that represents those of us that are on the front line taking care of patients daily. And our fight is to make sure that we take on our practice, that we look at laws to put in place that assures that we keep our patients safe across this country, no matter where we work. And the stronger we are, the more united we are, the more we work together to make these changes. And when a fight goes on, like we're seeing in Templeton or anywhere else, that we come from across the country, because their fight is our fight. Any fight that you're having on behalf of patients will be the fight that I will end up having at some point, and we need to stop this and make sure we keep people safe.
Well, we're talking about national fights. Let's revisit the healthcare fight for a moment. Here's some of what has been said over the last few months about the relationship between your own home state's health plan and the Obama plan. Take a look.
But in Washington today, among President Obama and many liberals, there's a view that if there's a problem in America, government can solve it best. And the example, of course, is health care.
Governor, let's look at the plan that you signed into law in Massachusetts in 2006. You have an individual mandate, an employer mandate, subsidies, minimum insurance coverage standards. It sure sounds an awful lot like Obamacare.
You've spoken out against the president's plan. Critics say it's very close to the plan you put into law in Massachusetts.
Massachusetts has, of course, this health care reform package that Mitt Romney, a 2012 Republican presidential candidate, signed into law. And the architecture is virtually identical to what we're passing into law here.
This health care bill is pretty much identical, or pretty closely modeled on the health care bill that Mitt Romney, that famous socialist, passed in Massachusetts.
Let me tell you, there's a big difference between what we did and what President Obama is doing.
Karen, back to you. I think whatever he may say, people get it, that the national plan is not so different from what you've been experiencing in Massachusetts. How's it working for you, and what do you make of what we've done nationally now?
Well, I think we're the donkey is basically what he's saying. But to be honest with you, we have issues. The Attorney General just did a review of where we are because of the cost of health care in the state. And one of the things which as nurses, they did a research study on and found that the cost to health care with nurses is like 18% of the cost. And that number has not changed over the years. So, as far as they keep blaming it on nurses being paid more, wanting more nurses at the bedside, to be honest with you, that cost has stayed low, remains low, and has nothing to do with what is going on. What I do is I work in a hospital that used to be considered to be a safety net hospital, which we took in those that, obviously had no insurance or were living in the community around the hospital in Boston. And what happened to us is we were the safety net hospital, and our funding got cut severely. And now we're trying to survive and still be able to take care of our patients and the population that we have. And what we're seeing is nurses losing jobs. Again, we're having more patients, we're having sicker patients, and it's not safe.
So does the new national plan look good or not good for nurses like yourselves?
I think that we have a lot of concerns about the national plan. If there's any indication what we're seeing in Massachusetts, when you try to cut costs, you cut services. And we seem to be one of, those that take care of patients seem to be the focus of that. And what happens is patients end up with less care. So you're paying more money and getting less care. And that's not acceptable to us.
Karen, thanks so much for joining us. If people want more information about the National Nurses Association or how you can find out more about what's going on in Philadelphia at Temple, take a look at our website, GRITtv.org, where all the links are handily laid out. Thanks for joining us, Karen.